All right, thanks for staying with us. Today we are talking more about Cancer Prevention Study-3, or CPS-3 as it's called, a major public health study organized by the American Cancer Society. Joining us today to tell us more about the study is a man who sees cancer every day and is working to prevent it, Dr. Vincent Reid. He's a surgical oncologist at Hall-Perrine Cancer Center here in Cedar Rapids. So, Dr. Reid, maybe you can tell us what this CPS-3 study is really aiming to do over the next 30 years.
Well, the CPS-3 intends to identify environmental, genetic, and lifestyle factors that may contribute to or prevent cancer.
Okay. And you see this kind of stuff every day in your work. Have you seen a connection exist? I mean, things have to be proven by studies to be effective. I mean, in terms of medical treatment.
I mean, if you look at the predecessors, if you look at the studies that took place previously, these studies started in the 1950s, and the initial study showed a link between smoking and lung cancer. Follow-up studies showed that smoking definitely decreased your lifetime. And the third study then showed a link between second-hand smoke and increased mortality. So we have had some groundbreaking findings from these studies.
Okay, so they're looking to find more of those over the next 30 years or so. So this is kicking off all over the country, but they're looking for volunteers right here in eastern Iowa?
Absolutely. So the intent is to recruit approximately 800 people in the Cedar Rapids area, for example, and at last count they had about 200 people that were enrolled. Okay. So we're getting there.
Okay, getting there. Who's eligible for it? I guess that's a good question, because if I understand if you've had cancer before, you're not eligible.
You're not. So the eligibility is any man or woman between the ages of 30 and 65 who have never had any personal history of cancer and are willing to make the kind of long-term commitment that we're talking about.
Okay, and what is that commitment in terms of, you know, I mentioned it's a 30-year study, so I mean, it's some commitment. Yeah.
Exactly. So that commitment is going to be about 20 to 30 years. And initially, I mean, you'll give some demographic data about yourself and a small blood sample, and then you'd expect to get a questionnaire every 2 years or so to update your lifestyle and your medical history.
Okay. Now, as a surgical oncologist, somebody who deals with, you know, seeing cancer patients every day, what are you hoping that this study can do?
Well, I'm hoping that the study has, you know, the similar success to previous studies, where it helps us identify some of those factors that, like I said before, cause cancer or prevent cancer, and so that this will inform our treatment of our patients.
Probably, and go a long ways for education, too.
Absolutely.
So, Dr. Reid, thanks so much for joining us, and we do have more information about the CPS-3 study on our website under the News Link section of KCRG.com.